That is something that our society needs. Lots of people repeat that on the internet. Doctor, it's an amazing method. I feel so energetical. I sleep better. I eat better. I feel so well. When it comes to skin diseases, the level of stigma is much, much higher. Some things happen after we start to regulate the way we breathe.
Please briefly explain what Wim Hof Method is.
Wim Hof Method is a combination of exercises that comprises breathing exercises, exposure to cold, usually in a form of cold water immersion, and some sort of mental exercise, meditation or attitude, proper approach to the exercises, to the difficulty they bring.
Could you tell us what kind of studies you conducted?
It was a study that involved introduction of Wim Hof Method into treatment of psoriasis, a chronic skin disease that really decreases life quality, and the results were pretty interesting.
Could you tell us what psoriasis is?
Psoriasis is an autoimmune disease that is basically hitting, and it's an autoaggression of your immune system that directly hits your skin and causes it to work improperly, and then causes increase of skin lesions.
This is something different than eczema or atopic eczema, right?
Well, it has a common part, but it manifests in a different way.
What are the key findings of your research?
That research proved that using Wim Hof Method, using the proper work of your mind, regular exposure to cold in a form of cold showers, that properly conducted breathing exercises can reduce stress of your mind and then stress of your immune system. Therefore, it doesn't attack, it doesn't panic, it doesn't overreact, so it stops to attacking your skin and the lesions, symptoms, itching or pruritus, or even your feeling of yourself improves.
I've read that during the study, COVID-19 lockdown happened.
Yes.
In the middle of it.
In the middle, exactly.
So how it affected the study, and how did you manage it?
It's a very interesting thing what happened, because when we initiated the study, when we just started with the intervention period, the training group was ready. Everybody was eager to start the exercises, and in the first 3-4 weeks, full lockdown was introduced. And the first lockdown, so everybody was afraid that another plague is coming. Streets are empty, news are hitting your mind so much. We're all going to die. This atmosphere is very, very tense. Everybody probably remembered that time. And so autoimmune disease is very related to the state of your mind. So it was probable that your condition of your skin should decrease, right? The skin lesions should increase in their intensity. They should, the level of inflammation should also be increased. And that actually happened to the control group. People in that group really said that they had to increase the intensity of the treatment, more lotions, more creams, and the level of inflammation also slightly increased. But what is interesting, compared to the group who trained, those people started to do the breathing exercises. They started to regularly take cold showers. They started to meditate, despite the fact that they had full houses, because with the kids, with everybody sitting on each other's head, meditation was kind of difficult. But the group totally, they managed to reduce that level of inflammation. They managed to improve the quality of their skin. They managed to prevent the inflammation to flare up. They managed to increase their sleep quality. They managed to reduce the intensity of itchiness. They managed to increase their mindfulness. So many positive things happened. during that time, despite the fact that COVID was the full lockdown of COVID-19.
Okay, very interesting. And what was the protocol for intervention group?
Wim Hof Method.
Yes, but exactly what did they do? I mean, did they go for cold exposure during the lockdown?
Yeah. So the cold exposure was in the form of cold showers. So we firstly we initiated the cold showers just with a slightly cold water for 30 seconds, and it was in the first week. In the 10th week, the proper way of taking cold showers was 10 minutes of cold shower and just blue, no red component, just blue, and 10 minutes of sitting beneath the water. Also breathing exercises that are typical for Wim Hof Method, and around 5 minutes of some sort of training of your focus, training of your mind, meditation, just directly after breathing exercises.
Were there any surprising outcomes that you didn't expect it?
First of all, that the study was successful. That was the biggest success and a surprise, because the first thought was that it won't work, because you cannot visit your study group. You cannot visit them. You cannot perform the exercises with them. The group cannot meet, and you cannot pass the information properly. All you can do is just to describe it properly, right? But the breathing exercises mostly are kind of a technical thing. You have to see the practitioner. You have to see the person practicing it to correct it in case they make any mistakes. So to switch the study from direct interaction to the internet, to the social groups, social media. It was the biggest surprise for us. We also measured, let's say, mental functioning. Let's say so. We checked in a brief way level of depression. And it turns out that members of the intervention group, those who trained the Wim Hof Method, in the beginning of the study, and the control group as well, they had, you can say, very slight depression, but very, very light, compared to the social, to the level of depression, let's say, to the rest of the society. You could say that they had a very slight episode, and they didn't actually know that you can function in a different way. Psoriasis is a skin disease that hits you in a very different ways, right? It doesn't just cause your skin to be inflated. It also it also causes you to function a different way. You feel as if you're very, very ill person. You cannot just leave the house if you have, for example, skin lesions on your face, right? So you feel ill. Everybody can see you are ill. There are diseases that you can hide, but when it comes to skin diseases, the level of stigma is much, much higher. So what I saw before and after, when I talked to the members of the training group, initially you could see the disease is eating them. When you talk with them, they will just... symptoms, yes, disease, yes. But after those 10 weeks, they were so surprised. They felt so energetic. They could say, "Doctor, it's amazing method. I feel so energetical. I sleep better. I eat better. I feel so well." And that was the biggest surprise for me, because let's still not forget, the COVID-19 epidemics is still on. And suddenly you see people being in such a good mental state.
They got some hope.
They got hope for sure, and that few of the members of that group, we are still in contact, and they like to remind other people and me also, which is very pleasant to hear, that those exercises initiated, and the taking part in that study initiated in them some sort of road inside, they started to take some path inwards, to explore themselves, and they managed to find that there is something deeper inside them, and made their life more rich.
Do they still practice?
Yes, some of them, yes, and they still do it, and their practice evolves. It's not just Wim Hof Method. They also started to practice other breathing techniques and observe them, modifying according to what intuition tells them.
You mentioned meditation. Do you meditate yourself?
Yes, I do. Yes, I do, and then I think it's very beneficial.
It is, I agree, and I ask that because my previous guest, let's say she's a meditation specialist. Do you know Patrycja Pruchnik? She's from Warsaw, and some people call her a spiritual teacher. I know this is hocus pocus for some people, but from my perspective, it's so practical. I recorded her asking a question for you.
So my question to Dr. Jan Czarnecki would be that: what brought you to this kind of studies? How this impacts your own life? This is my question for you.
Very pleasant question to answer, I have to say. What brought me, so to paraphrase, what made me doing those studies, right? I don't know. I feel like something made me do that. It wasn't like my choice. I feel like it happened to me. I feel like some random situations made me be interested in it. One of the examples could be two of my friends, totally not knowing themselves, independently send me the same scientific paper. Some people said that a scientist realizes the archetype of a traveler, of a person who goes on a journey, because that person, let's say, leaves the area that is known, the same in a way as a traveler does, explores some terrain, people, animals, I don't know, just area that has been unknown, and then after making taking the knowledge about this place, the person returns to his own group and then tells the story what he or she saw there. So I think that inside of me there is still of this traveler that is interested with unknown. And when it comes to impact of breath, impact of cold on our bodies, it is still a very unexplored area, very fresh, very new. So I think that made me, to answer the question made by Patrycja, I think that was one of the main motivation to do so.
This was a proof of concept study. Does it mean that you will continue going this path and there will be a bigger study maybe in the future? More general question is, what are the next steps for you related to that?
Definitely. It was just the beginning, I think. Me and Professor Mokros, I think we will be able to go forward with studies that will involve exposure to cold and breathing exercises. We presume that in those two aspects, or three, because also it involves some sort of mental work of your changing of your definitions, the functions in your mind and conceptions. So all those things, and your approach to difficulty, like cold, like proper breathing exercises, it is some sort of difficulty, and that trains your mind, trains your body. And also important is to perform the exercises and what your approach to it is, right? So all those things I just said are going to be the topic of our future studies, definitely.
Now I have a personal question. We talked about it just before the interview. My 6-year-old daughter, her name is Maya, and she suffers from atopic eczema. And I know it's totally uncharted territory. Like, it's nobody did it before. And maybe you have some intuition about treating atopic eczema with methods like Wim Hof Method.
Avoiding the topic of intuition.
Okay, yeah, of course you are.
Of course, all the studies start from intuition. We cannot, we have to say that. But beside that, There are lots of people that said that Wim Hof Method helped them in their topical eczema. Lots of people repeat that on the internet. If you would go into that society, people who practice that, you would see that there are people who said that proper breathing exercises, exposure to cold, help to mitigate their symptoms. When it comes to irritation, I think that Buteyko breathing exercises could be even more efficient when it comes to atopic eczema. I think that results would be quicker to be shown.
And why is that? Because Buteyko method is decreasing the amount of air we breathe in, right? So how you think it's connected, related to the skin condition?
First of all, we cannot reduce the way the Buteyko method works just into amount of air we breathe in and breathe out. It's not easy to quantify, to find a proper number where we can measure and see how somebody breathes in and breathes out and what happens inside his body. Because when it comes to air exchange in our bodies, it also is related with functioning of our nervous system. And that is kind of harder to measure and in an objective way. So I think that Buteyko breathing exercises manages to calm down autonomic nervous system in a similar way the Wim Hof method does, but it is less, let's say, vivid, less black and white. It's more subtle thing. Therefore, some things happen after we start to regulate the way we breathe and reduction of symptoms of your disease. What is between? We still do not know, but for sure, reduction of air we breathe in and we breathe out, for sure, it takes place. But also some phenomena is also taking place, but we still do not know exactly what is it.
Coming back to children suffering from atopic eczema, children doctor always prescribed cortisol. I know this is not your area, but do you have any opinion on giving cortisol frequently to children?
Well, it isn't a hidden knowledge that giving glucocorticosteroids has some side effects, right? And every doctor knows that. But if somebody's condition is that severe that he or she requires to take glucocorticosteroids, this drug can save. It saves lives, right? So we have to be aware that some achievements of medicine, that is pharmacological, cannot be denied. But also we have to be aware that using some of the substances also has its own side effects. So it is necessary to have balance in those treatment ways, in those treatment decisions. I think that I am sure that using Buteyko method, one can reduce the amount of steroid. Mostly it was proven in asthma when it comes to amount of glucocorticosteroids used in an inhaled way, in an inhaled form. So Buteyko method was proven to reduce amount of those substances in 50%. So in the time of 3 months, more or less. So it's a big achievement for those techniques. When it comes to prescribing hydrocortisone, there are some cases that this is necessary, but let's be timid about it. If we can reduce the amount of steroids used by just techniques, it's a very, very, very beneficial thing.
You convinced me to do Buteyko with her even more. I had one aha moment, because one time she had a flare-up. She started to scratch her skin very intensely, and I realized that she's breathing through the mouth, like during panic attack, kind of.
Yes.
And at this moment, I asked her. It wasn't easy task to ask her.
That moment.
At that moment, because she was just.
Imagine that.
She didn't hear me, actually. so much. So
She was
focused
so focused on the...
so focused on the skin. But after 20 minutes maybe of asking her to calm down, to breathe in more calm way, to
gain
prolong
control.
the breaths, each breath, and do it through the nose, of course. She did it finally, and
Congratulations.
thank you so much. But congratulations to her, because she decided to help herself, right? And when she did it, it wasn't too long. It was 1 minute, and suddenly everything really calmed down. She calmed down. The emotions went away, and the following step was the skin. It just, it was still red and a little bit bleeding, but the flare-up stopped.
Yes, and the feeling of itchiness
Also
was manageable, I imagine.
Yes.
That she managed to withstand, not to have the urge to scratch it. She managed to gain control.
Yes.
Amazing, perfect.
And that was the first milestone, let's say, because afterwards she had like the moments of like realization that, oh, this is the moment that maybe something starts itching a little bit. And she just remind herself about that moment, and
she knows what to do.
Calm her down, like kind of mindfulness, I don't know, exercise or something like that.
That's
this is so beautiful to see in children.
Yes, and you gave your daughter a tool, right, to solve the problem, right? You taught her what to do. She wasn't just left alone to the phenomena in her mind and in her body. She could control the situation, and she could reduce the symptoms. Very good. That's the point.
And we will continue that path. Now she's, of course, she's just a child, and she has to be reminded more often. But the first step is done. So, next question is, what are other maybe similar techniques to the Buteyko and, of course, Wim Hof Method? Anything else that you recommend?
I recommend any technique that manages to teach you to go inside yourself. Any technique, any group of exercises, anything that you train and you learn about how to control your breath and manages to teach you how to control your mind is good. Practice, of course, without any exaggeration into any side. Practiced with your mind, with your control and awareness, gives you possibility to look not only on your breath but also on your life in a different way, and that is something that our society needs. I think that if we were more, the result of all those techniques could be more mindful, many things in our society world would get better.
What is your response to skepticism? Probably there's many. Probably also in the medicine world.
Yes. There is a solution. Conduct a proper, high-quality scientific studies. That's the only way. Maybe it is hard, but that's the only efficient way. And what is interesting when it comes to Buteyko method, quality studies have already been conducted. There are still question marks that are extremely interesting to find answer to, but second component is not only to conduct the studies but to be patient, right? Patiently explain what has already been proven, what you presume, what your intuition tells you, and to be third thing, it is important to be honest. Like if you're not sure of something, don't say that you are sure of that. If something was not proven yet, leave the question mark and do not get tempted with a definite answer, because lots of people want definite answer and they want an answer, you want an answer, but what you have to do is to be timid about yourself and them and say, unfortunately, we still do not know yet.
Thank you so much for your time, for great answers.
Oh, thank you.
Still have one more question.
Okay, go
the
ahead.
answer is to be written in this notebook. The question is, one life lesson you think it would be worth to share with someone you care about?
one life lesson I like it will be valuable to share with somebody else, right? One lesson.
Somebody else with person you care about, so it's really, it must be something really, you know.
Okay, I'll do that. Okay, I think I have something taken right.
One more thing, please ask the question to the following guest.
Okay, so following guest is going to be Professor Mokros, right?
Yes.
Okay, Professor Mokros, please answer the question that goes, what is the most interesting thing when it comes to studying the mind?